sagittal T1. Let me grab the T2. So this is a axial T2 because brain fluid is bright and fat is also bright. T2 seems fine. Oh, there is some atrophy. Some atrophy of the temporal lobes. Mesial temporal isn't very good. Still, slight dilatation of the ventricles right there, but there is prominent here. Temporal lobes aren't really good. She has lost a lens. She still has one lens to go, and she has gone through some kind of surgery right there on her right eye. So cerebellum and brainstem are fine. Thalamus also. T2 is fine. Let's grab a FLAIR. This is a T2 sequence with an additional pulse to saturate normal brain fluid, and this is really noisy. This is bad. There is some gliotic site right there. Let's compare it to the T2. Yes, gliosis for some reason. Let's just not hope. Yes, it's there. The atrophy is most prominent on the polar regions of the temporal lobes and the mesial temporal regions. So it makes sense with the complaints of memory loss. The amygdala is also affected. So this is probably a Alzheimer's disease case. A classic Alzheimer's disease case. So that site of gliosis has no signs of restricted diffusion. Hey Tim, what's up? Oh boy. Hey, there is something here. Check this out. It seems to be more than just flow artifacts. Really? I did get a nice night of sleep this past night, but it seems to be not to be enough for my grumpiness to go away. I'm glad you are better of yours, because grumpiness makes the day much harder to pass by. There is something wrong right there. I don't know what that is. T1, yes, it's there. There could be a meningioma. It's clearly an extra-axial lesion. This could be a Magnum foramen meningioma, which is kind of rare, but could be the reason for this medulla oblongata compression right there. This is also called, in Portuguese, this is bulbo cerebral, but in English it's I don't remember. Let me just Google it. I always miss this one. It's crap. Let me Google it, because I'm at DuckDuckGo, and DuckDuckGo isn't that smart. It says brain bulb, but it isn't. It's medulla oblongata. I don't know how to call it in proper English, just in the Latin. Say it seems to be it's probably medulla oblongata. Yeah, sleeping well is the key, man. And coffee, of course. My coffee is gone. I have to make some more coffee. But coffee and a good night's sleep should be enough for me to get back to my feet. But yesterday I was crushed at BJJ practice. Crushed, mate. really crashed. And today I said to my coach that I was going to do a double practice, a 5 to 7 practice. We are going to do both no gi and gi, and it's going to be awful. I'm going to get crushed both on no gi practice and then on gi practice. This is going to be freaking awful and fun. And I'm quite sure that's where my grumpiness is coming from being sore all over the place. So getting back to the scan, I'm pretty sure this is a meningioma of the foramen magnum. Right there. Let me just write that down. 1.6 by 1.1. It's right there. It's pretty close to the cortex on most sequences, which is a very common feature. See, this kind of gray is really close to this kind of gray, and this kind of gray right here. If this was a better scan, it would be easier to see. And this is the most common extra-axial tumor on human brains, and also really common right there on, see, it's the same even on diffusion weighted and ADC maps, and it has some expensive effect, some mass effect. Is it partially calcified? It is partially calcified, see? So this is an SW sequence. It's black whenever there is calcification, mineral deposits, or blood products. So, man, this is one freaking